Your hip arthritis is keeping you from doing the things you want to do. It hurts to walk and climb the stairs. You have pain getting in and out of the car or standing from a seated position. You've tried conservative treatments like anti-inflammatory medicines and physical therapy with no success. The goal of hip replacement surgery is to help ease your pain, restore function in the joint, and make it easier to do all those routine things you were finding tough. Before surgery, you and your family will meet with your surgeon and his team to educate you on the risks and benefits of surgery and expected outcomes. You'll also be asked to do what you can to optimize your health through weight loss, diabetic control, and quitting smoking. Our multidisciplinary team is here to prepare and support you every step of the way. In a hip replacement, an orthopedic surgeon replaces the ball and the socket of the hip with various forms of metal, ceramic, and hard plastic. Your new hip is made to last 20 years or more. What should you expect after hip replacement surgery? There are 3 phases of recovery. The first phase begins immediately following surgery and is all about healing. Your doctor or physical therapist will have you walking the same day as your surgery and will encourage you to walk with a cane or walker. Most patients typically transition to phase 2 within a week. The second phase typically lasts 2 to 3 months. You'll become less reliant on your walking aid. You'll start outpatient physical therapy, and depending on your situation, you may be able to go back to work. The third phase is self-paced, with most patients experiencing a full recovery after 6 months. Most people see significant improvements during this time. With your new hip, you should be able to walk, hike, ride a bike, swim, and golf again. Brought to you by the experts at UPMC Orthopaedic Care.